My name is Dr. Deepa Shah, and I'm a gastroenterologist who works at HonorHealth. Colon cancer is actually quite common. It is actually the second most leading cause of cancer death in the United States. Colon cancer is very preventable. Colonoscopy is the gold standard test for prevention of colon cancers. All adults at the age of 50 to 75 should have a screening colonoscopy. There are many signs and symptoms of colon cancer. Red flags to look out for would be something like bowel changes, meaning constipation, diarrhea, change in the caliber of stools, so if they're harder to come out, a pencil shape, blood in the stool, rectal bleeding, unexplained weight loss.
I'm Dr. Stuart Treaster. I'm a staff gastroenterologist with HonorHealth. A colonoscopy, the procedure itself, is about a 20 to 25 minute procedure that starts sort of the day before, however. In order for a colonoscopy to be completed successfully, our patients have to be on a liquid diet the day prior and go through a bowel preparation in order to clean their colon so that we can see during the procedure. The day of the procedure, they come in and an IV is placed, and our anesthesiologist then gives sedation through the IV to make patients comfortable for the procedure. Then we go in with a long, thin tube that has a camera and a light on the end of it and take a look through the colon to identify any problems and potentially remove things like polyps or take biopsies or things of that nature. And then afterwards, a little bit of recovery time, opportunity to discuss results, and then the patients go home. Many patients may not have a polyp, but if we do identify polyps during the procedure, in almost all cases, those polyps are removed at the time of the procedure. Those polyps are then sent to the pathologist to make into slides and look under the microscope to identify what type of tissue they see. The average 50-year-old has roughly a 1 in 3 chance of having a precancerous polyp. If left unchecked, any precancerous polyp is potentially capable of turning into a colon cancer in the future, and that is truly how colonoscopy saves lives, by removing these polyps before they become colon cancer.
The best test is the one that gets done. And I think that, there are always self-perceived obstacles like, oh, well, I don't want to burden somebody as a driver, or I don't want to take a day off work. But in the end, it is worth it, especially if it is a preventable cancer. If we can find polyps in the colon, take them out, remove them, and prevent a cancer from happening, we've potentially saved a life, and that's priceless.